right, it does feel good to be here again. Remember, at the early hours of today, that's talking about the 7 o'clock hour, I made it clear that there was going to be a guest who's going to be joining us at the 11 o'clock hour for Mind and Body as we go talking matters that concern health. I mean, health is something that is wealth, but how many of you have even taken time to give your body, your health, the necessary attention that it deserves? Oh, some rhetoric question there. But yeah, you know yourself better than I do. But then that also brings us to the conversation today, as we'll be looking at the breast and cervical cancers, the causes, the symptoms, and the solutions. Now today, we're joined by Dr. Talimor Wycliffe Da. I hope I pronounced that one correctly. Right. Okay, he's a renowned clinician, an expert in obstetrics and gynecology. Now, Dr. Da has worked extensively in Nigeria, managing complex clinical situations and promoting healthcare development. Now, we'll be looking at the causes, symptoms, and solutions for breast and cervical cancers, particularly in the Nigerian context. Well, welcome aboard to the discourse this morning, Doctor.
Thank you. It's my pleasure.
Okay, so here I was, the first time I was told that the doctor will be talking about breast and cervical cancer, and I'm like, oh, he's a female, yeah? I said, no, it's a male. I'm like, what's happened? How is it a male? Don't you think as a female that should talk about the female body better than the male? Now look at my shock. Yeah. To have you in the studio as a male. Yeah. But have you ever had that type of jab thrown at you? You're a doctor and you're a male. How? Shouldn't it be a female or something?
Yeah, once in a while, some people think that it should be female to take care of female.
Right.
But I think I take care of females for a living. So you can see me as an associate woman if you like.
Oh, okay. So you heard it. You said you can see me as an associate woman. But anyways, though, how has it been for you, though? I mean, this, line of work that you do, has it been the experience? That's what I'm asking. How's the experience been for you?
Yeah, it's been a great work. It's a field that combines the other fields as well.
Oh.
You will do a bit of things about children or neonate. You're going to do a bit of things about surgery. You will do a bit of things about every field of medicine.
Okay.
If you are practicing obstetrics and gynecology.
Okay, so it's a bit of every other aspect.
Yeah.
Oh, awesome. So let's look at an example of a Nigerian woman just before we jump into the discourse. Yeah.
Right.
So a Nigerian woman who chooses anonymity in view of the topic today. According to her, she battled breast cancer for 7 months after routine checkup led to a life-changing diagnosis. Now, she faced not only physical challenges, but also societal stigma. Despite being marked in distance by some, she found solace in her faith and the support of loved ones as she navigated her new reality. Now, she soon discovers a sense of community and solidarity with other breast cancer survivors, and this has led to a remarkable change in her life for good. Now, she is in the business of mentorship and guidance to other women who suffer same. Well, let's get into the big questions now. Let's understand it. What are breast and cervical cancers, and how do they occur?
Right. We all know what the breast is.
Yes,
the breast
most
is the mammary gland.
Yeah.
In humans, there are two, and males and females, they have them.
Okay.
If a woman delivers, that is where she suckles the child from. And because that function is not needed in the male, the organ doesn't develop much, so
Okay.
it is not big and protruding kind of.
Yeah.
The cervix is an entirely a female organ. It is the common name is to say it is the neck of the womb. The womb is the uterus, is the place that the baby stays to grow. And if there is no baby, it's the place where menstruum comes through the womb and follows through the cervix to the outside. So the cervix is kind of the neck of the womb. Those are the two different organs. When cancer develops in this, they are called breast or cervical cancer.
Okay. Okay, so that's it. All right. Well, breast and cervical, cervical, you call it
Yeah.
cervical. Okay, correction taken. Breast and cervical cancer. They're quite significant health, concerns, and they affect women globally, right? Particularly if we come down to Africa and Nigeria, according to the World Health Organization, that is the WHO, cervical cancer is the fourth most common cancer among women worldwide, with approximately 570,000 newer cases reported annually. In Nigeria, breast cancer is the most common cancer among women, with a high mortality rate due to late detection and limited access to health care. Do you agree with this? Totally.
Yeah, those are right
Right.
statistics.
Right. But then, what are the possible causes of breast and cervical cancers, though?
For maybe we divide them,
Okay.
breast and then cervical.
Okay. Awesome.
They,
Awesome.
they only share one or two things that you could say they are possible causes. But when we talk about the breast, causes, you can hardly find something that you can relate directly to the breast. That this, you eat this, you get this. You drink this, you did this. You are this, you get this. Even those that we say they have genetic predisposition, they don't always have to develop it. And even those that we say they don't have the risk factors, they don't tend to develop it. So rather than say causes will have a cause effect.
An effect, yes, cause
Yeah.
effect. Yeah.
But risk factors are things that places you in the vicinity of acquiring such thing.
Yeah. I get
So
that.
for breast cancer, we should talk about the risk factors
Okay, so
rather than
the causes.
the causes. And the risk factors, they will include the fact that you are female, because like I said, males have the breast also.
Yeah.
But they develop cancer also, but not as common as the females who develop it. And also any history. If you have a family history that your mother, your sister, your daughter developed breast cancer, you stand a higher risk than somebody who does not have that family history.
Okay, I get that.
If you yourself, talking still about history, if you yourself had a breast cancer some years ago treated, you stand a higher risk of the other one having a cancer. Or if you yourself also has a history of some conditions that we call pre is before,
Okay.
precancerous diseases, some lesions that are not full-blown cancer, but when we see them, we know that if we leave them for years, they're going to develop to cancer. If you have a history of that, you will also stand a risk, more risk than the general population.
So sorry to cut you. I've heard about lumps. Is that
Yeah.
also a part of risk factor?
Yes.
Oh,
if you're
okay.
developing lumps.
Lumps,
Because
okay.
some of these lumps are part of the precancerous things.
Right.
Some are outright cancers themselves.
Oh.
We have to check to know what exactly is. So those group of things I've spoken about are history. But some have, connected to this history is the likelihood that it is genetics, meaning that some of the genes that your relations had, you had it too. So one or two genes may be implicated that if you have it, you stand a higher risk of breast cancer than other people. The other things are developmental.
Yeah.
If you happen to, normal females, we see their period at some point that we call menarche, you're beginning to see period. And at some point we say menopause, the period is stopping.
Okay. Menarche, when you began.
Menopause, yeah.
Menopause is when it stops. Okay.
If you start that menarche quite too early, like maybe earlier than 11, 12 years,
Yes.
you are likely to stand a higher risk. And that is unfortunate because today, a lot of our girls are beginning that menarche at 8.5, 9 years, 10 years, for reasons that they are exposed to things that sexuality things on
Really?
television and so on.
Really?
So if you start earlier than 12, you start a greater risk. And if you end your reproductive years, the menopause comes like 55 or later, you also stand a higher risk. So that's it. The other thing is, well, How they got about these risks is when they do large studies, they discover that this group of people stand these risks. If you do not give birth early, if you give birth late, like nowadays is the case, a lot of people give birth after 30.
Yeah.
You are likely to develop breast cancer. I mean, you stand a risk. Remember, risk doesn't mean 100% causation.
Okay.
But likelihood, like I said, you stand in the vicinity of contracting that.
But why? If I'm not giving birth, if I'm giving birth late, yeah, I'm trying to understand why. Is there something that is it because?
How these things are found
Yeah.
is by demographic studies.
Okay.
You study
Okay.
and discover that it looks like it is women who are older that develop breast cancer. It looks like it is women who give birth a little late who develop breast cancer.
Okay.
Those are first of all demographic findings.
Okay.
And then the scientists go to work to say what exactly is the problem. Is it because the organ is put to action later than when
It's ought to?
Yeah.
Oh, I see that.
Well, those are theories.
Are you talking from a place of breastfeeding or
Yes,
something? Okay,
yes,
I get that.
Yes.
I
And
get
then
that.
those are theories. And when the theories are developed, they do tests again, they do research again to find out which is which. So for now, we cannot really pinpoint what is exactly.
Because it's still evolving. I get that.
The reason for that. So coming back to the risks.
Yes.
Again.
Yes.
If you happen to have had a situation in the past where there was a need that you got some radiation, maybe you had cancer of another part of the body and they had to use radiotherapy on you
Yeah.
when you are younger, later you still stand some risks of developing breast cancer. And then if we come to behavior, behavioral things, if you smoke a lot, and if you drink, and for drink, I don't think it has to do with any quantity, but if you drink and if you smoke, you stand a higher risk of developing breast cancer. So you can see the risk factors are quite many.
Now you heard it now.
Yeah.
You drink a lot, you smoke, you stand the risk of developing breast cancer. Is this only limited to the female, or you're talking both ways now, but more of the female?
Most of the studies are done in the female.
Oh, in the
So
female,
it's
okay.
more in the female.
All right.
So those are for breast cancer.
Now for cervical, cervical. Okay,
Yeah.
cervical. He said.
Well, you could call it
Cancer.
anything.
Cervical.
Some people call it cervical, some
Yeah.
people call it cervical.
Okay, for cervical now,
Yeah.
what would be the risks? Possible risk.
For cervical, it has to do with the changes of the cells that line that cervix.
Okay.
And if they get some form of irritation or whatever, as early as they could be. For a long time, theories were developed where people say, oh, if you have sex early and maybe something starts touching that cervix too early, or semen starts touching that cervix too early, they had also linked smoking, but because despite the fact of early sexual exposure, you may find it still on somebody who has never had sex.
Right.
But there are also those that probably smoking, and then some, maybe the tribes you came for, and so on. Those were the theories related to it. But with time, it was discovered that there was a definite causation from infection from human papilloma virus.
Okay.
The kind of virus that causes warts. I think everybody knows about warts.
Warts. Okay.
There are some small, hard swellings
Yeah.
occur. That some of the viruses that cause warts definitely are related to the causation of cervical cancer. So for cervical cancer, we could say yes, it's a human papilloma virus, which maybe I can call HPV. Some variants of it definitely are linked to cervical cancer.
All right. Okay. We're still having a conversation now, and it gets even tougher and deeper as we go conversing. But thank God we have our guest who's here, Dr. Talamore Wycliffe Da, who is a renowned clinician and expert in obstetrics and gynecology, to guide us through. Now, let's look at the symptoms of breast and cervical cancers. What would they be, if you were to tell us from a professional?
So again, let's divide it from to the breast.
The breast and then the
Uh,
cervical.
If there are symptoms linked to the both of them, it will be that the person will lose weight,
Okay.
be sick,
Yeah.
wouldn't want to take something, lose appetite. Those are general symptoms that they could share. But because they are different organs, symptoms will come according to their location on the body and according to their functions and according to the type of cells that are found on those organs.
Okay.
Yeah. For instance, for breast cancer, most times it's symptomless. A lump in the breast could be growing and it's not painful and it has changed its nature. And if you do not go to check regularly, you may not notice until it gets quite big before you say, oh, I think I have a lump.
This
So
is
the
serious.
presence of a lump is a symptom that some people might have.
So
But
you
at the
advise
beginning,
you
there is
advise
no
what?
symptom.
You advise what? Regular check-in?
Regular checking. It is said that you check by yourself,
Okay.
but that is so that it can take you to the hospital to check.
Oh, okay, I get that.
To confirm
Yeah.
by a clinician. So mostly a breast lump will be found. It's not painful most of the time. A few times, depending on the type, there may be pain. A breast lump could be found. Now, on the breast, there is skin covering the breast. You may begin to see some changes because for lump, you will see that there is a swelling
Yeah.
on the breast. For skin changes,
Yeah.
you see that those growing cells are drawing. They are drawing the skin inside, so that the skin now looks like orange peel,
Okay.
the back of orange. You know
Yes,
how it
yes,
focuses
yes,
inside?
yes.
Yeah, the skin could look like that. There could be other changes depending on your skin color.
Okay.
If you are black, it may turn blacker, darker, or even purple or red. If you're a white person, it may turn red, or pinkish.
Yeah.
So the color of the skin could change. The
Around that area.
Yeah, the consistency of the skin over the cancer could change, and unfortunately, a few people will even come with a wound, with an ulcer
My
on
goodness.
the breast. That is skin. Then on the nipple is the central part where the baby sucks.
Yes.
That's projecting. It may no longer project out. It may be flat or it may be drawn in. Or unfortunately, it may start swelling bigger. Then you know that there is a problem. Or it may start discharging bloody stuff or some color that is not normal breast milk.
Okay.
Yeah.
Okay.
So that also is a symptom.
Wow.
For some people, they begin to have pain and limitation in activity, maybe of their hands and so on. Much later, if you catch it, it may affect the organs that are nearby, the muscles under it, the armpit, and then the chest. And so they could easily migrate to the chest and cause chest symptoms.
Wow.
Cough, difficulty in breathing, and all that. That could happen. So those are symptoms of breast disease. And because it's causing certain symptoms, it may make the person lose weight
Oh.
as well. Like I said, they share that with
Yes, with cervical
cervical
cancer. Okay.
For cervical cancer, again, in the early time, if you do not check, it may be there and nobody's going to know because the cervix is staying there, out there as the mouth of the womb. So in the early stages, you might not see that it is there. But one of the symptoms may be that after the person meets her partner, she may have a bloody discharge. That may be the first symptom.
Okay.
And so that will lead her to complain, and then we will check to see and do tests to know that it is. For those who catch very late, they will come with frank bleeding, and they will come with pain in the pelvis, and they will come with maybe lumps somewhere along their navel,
Yeah.
and so on, because they are coming very late.
Yeah.
Yeah.
Well, how can breast and cervical cancer, be prevented or detected early? I mean, I think we've gone past that.
Yeah.
But let's look at this one. Are there any treatment options for breast and cervical cancers? Are there
There are.
treatments? Is
There
it
are.
permanent? Is it just something we manage through life, or is it a permanent type of treatment where we say, okay, we've eradicated the whatever is causing it?
It's both permanent and also
One that we can manage
manage
through.
it.
Okay,
Yeah, it's both permanent and
Alright.
we can manage it.
talk to us.
If at the point that the tumor mass, the mass of cancer cells, is small and has not spread to anywhere, and by surgery you scoop it all out,
Okay.
and that will be the end of it. That means it's completely treated. So it is, yes, it's completely treatable. But when it goes too far that you cannot completely collect it out by maybe one form of surgery or the other,
Yeah.
then you are talking about managing it, because you're going to give things to suppress it.
Okay.
You're also going to give things to kill the cells, but you may not end up killing them. You cannot kill the cell of the whole body in the name of treatment.
So is it that they attach to our cells,
No.
but they just multiply?
They just multiply
Yeah.
and then find ways through the blood and the lymph system to migrate to near organs or distant organs.
Oh,
So if you found them in one place and treat,
yes.
then if they had migrated, then you need to deal with them to where they have moved to. Yeah, you need to deal with them to where they have moved to.
Okay, so how can we increase access to healthcare services for breast, and cervical cancer screening and treatment?
The good thing
Yeah.
is that we have primary health centers
Okay.
and health centers everywhere where we think the detection and the treatment can be increased by training health workers to know how best to do it. But then you have to push the people to come to the health services.
Okay.
So
that's the challenge.
information
That's the
what-
challenge.
Like what you are
Yeah,
doing
what
now
we're doing now, yeah.
is what is
Vital.
perhaps the greatest thing, to ask that please go regularly to go get checked. Some countries have a program for their people that every year they're going to check the breast, every year they're going to check cervix. So they make it. For us who are in low and medium income countries, we do not have the resources to do that exactly. So what we do is that whoever does come, we offer the person the opportunity. Even if you came with a whitlow, we could ask you that, hey madam, have you had a pap smear? Have you had a screening for cancer of the cervix? Have you had do you check? Have you had a
Okay.
screening for
Okay.
breast cancer? Even if the person came with something different, you catch the person, you do it right there. Do not wait, because the person may not even come back. So there is the pushing from information given either from media houses or deliberate community sensitization given to the communities, and then there is the reception and the availability of resources at primary health center or other health services
Yeah.
to grant them that. That way we can increase the screening for these.
Right. Awesome. We're still having a conversation with our guest, who is in the person of Dr. Talimore Wycliffe Da. And we're looking at breast and cervical cancers, causes, symptoms, and solutions. And you want to put a question out there, you want to ask one or two questions. I mean, this is like your opportunity to get awareness as well as answers to those salient questions that you've asked but not asked out loudly, right? And this will be the number to call: 0907 353 0044 or 0908 766 8888. Send us a message via the WhatsApp portal number 0909 705 4450. And yes, if you know somebody who is in that already, who's experiencing that and yet is refusing to come out to talk, you might as well want to connect with us, and let's see how we can send this message across. Keep in mind that September 20th to October 19th, of course, is International Day Against Breast Cancer, and it's more like a month, actually, for that, event. It does mean that this is a serious thing. And then when you go to the hospital, maybe you, as the doctor rightly said, you go maybe for a Whitlow check and all of that, and they say, please do a breast cancer, check, do a cervical check. It's not because they want to collect money from you, because most of the time it's all about, oh, I just went for weight loss, and you're asking me to do, excuse you, oh, these Nigerian doctors and their hospitals, that's always the feeling. But no, it's because they actually have you at heart, and they want to be sure that aside the weight loss, that hope there's nothing else that you're probably out of negligence or ignorance you're not aware of. They just want to help through, right? That's what it is. All right, so hit the numbers already and let us have your thoughts in the discourse this morning. All right, we'll just go on a quick break and we'll be right back in a short bit. Don't go away. This is Mind and Body.
Do you have questions about your health? Well, look no further. On Mind and Body, you are our business. Tune in as we discuss with health experts on everything that concerns you and your well-being. Mind and Body. Mondays, 11 a.m. on Eagles 102.3 FM, Abuja.
Would I never hear this one before? This now upgrade promo from my Abuja Home Limited. For their land, where they Guabalada pay 700k for 250 square meters. This one be say 81% discount. Abi, you can't go for their premium, where be 500 square meter for 1 million naira. This one be 80% discount. And the original price now 5 million naira. Their land get Obonge document from Abuja. Oh yeah, sharply go get your land for Broadwater Estate for Paiko Gwagwalada. And this opportunity is there for our military officers and men too. You fit to green us. I be making WhatsApp us for we number will be 08088837426 08088837426. I be making call this other one 08082723824 08082723824. My Abuja home. Now landlord will want make you be.
For every Naija man, woman, pikin and the future wey we dey hustle for, two strong names don finally jam. Na confidence bind us together. Dis na Naija wey everyday dey show you say better fit happen. As you dey hustle, dey push and dey try to make life better, you suppose waka with strong mind. But make we yarn as e be, confidence pass hope. E mean say no matter your waka, no matter who you be, you get who dey your back. Dem go stand for your matter, hold ground, make you no fall. Sanlam Alliance sabi say confidence no be for only people wey get levels. E belong to everybody wey dey try. Na why we join hand. Two strong bodies don turn one heartbeat to give you the main protection wey go follow you for this life journey. Whether na for business, family or for your daily bread, we dey your side. As we don jam, we go fit protect you pass before. They do more together and they carry each other, they go front. Sanlam plus Alliance don't be one name. Sanlam Alliance. Make una waka your life with confidence.
Abuja, something big is coming to the capital. Yankee Entertainment presents Joe Boy live in Abuja. Come vibe to live performance by Joe Boy. Joe Boy is coming with some friends. Date Friday, 25th July 2025. Venue Transcorp Hilton, Abuja. Time red carpet 5 p.m. Main event 6 p.m. Get your tickets now. Early bed regular 15,000 naira. Early bed VIP 30,000 naira. Regular 25,000 naira. VIP 45,000 naira. Tables gold 2 million naira. Platinum 4 million naira. Get your tickets now on www.apitix.com. Call 0702 536 4691. Follow at Malam Yankee for updates. Joe Boy live in Abuja. Supported by Hennessy, Z Cotton, Kairos Hoff Energy, Power Horse, Transcorp Hilton, Tokyo Nightlife, and Eagles FM.
And so we're back with Mind and Body now as we examine breast and cervical cancer. The causes, the solution. Well, the doctor has said no, we can't really say causes. We can only say the risk, factors, basically. Well, and we'll just go straight to taking your calls already. Hello, good morning.
Hello.
Yes, good morning. Good morning, my brother. You almost got me there. Yeah.
Please, my name is Ikechukwu calling from Gwagwalada.
All right, Ikechukwu, go ahead.
Please, I want to ask the doctor as a gynecologist now. Is there any, or is he a breast that has wound? Must the person go for cancer screening? That is one. Whenever you discover that you have a wound on the breast, especially maybe somebody that's breastfeeding and you have a wound there. So is it the wound on the breast? You must go for cancer screening. That is one question. Then my second question is a woman that has undergone a surgery, maybe polystatic ovarian cytic surgery, and it's more than 2 years. Now, how long will the person get healed before the person will conceive? Will be ready for conception again. I hope you get the question.
Yeah. Okay.
Thank you.
Yes, okay, Chuka, thank you. Right. Let's have that thought. He's asked two questions, solid questions.
Yes. The first is if there is a wound on the breast, and she qualified it that the person is breastfeeding.
Yes.
And if the person is breastfeeding, sometimes if you don't place the baby well on the breast, the baby sucks. All the energy of the baby is on the lips, catches the nipple.
The nipple, yeah.
It presses hard, so they crack. When they crack, bacteria on the skin can infect the nipple and causes some wound. If it is that type, we know that they are caused by their nipple cracks.
Yeah.
You only need to go, so they teach you how well you can place your baby so those things don't occur. But if you have a wound, especially the ones occurring by itself on the breast, or you have a wound caused by something, you hit it somewhere and there is a wound that refuses to heal as soon as you expect, you should go check for cancer.
Right.
So that's important.
Okay.
The other question is on if you've had surgery on the ovary, how soon will you be expected to try to conceive? If you had surgery on the ovary is such an organ that is a very active one. If you had surgery on the ovary today, in the next few weeks, you should ovulate.
Okay. Few weeks.
Be able to ovulate, even in few weeks' time, if you are within the reproductive health, age. So it doesn't take years. It shouldn't take a year. It shouldn't take 2 years. If everything is normal, you're going to ovulate perhaps the very next cycle.
Oh, okay. Well, the questions have been answered right there. You have more questions, more concerns, and all. Bring it and connect it to 0907 353 0044. Taking this one right now. Hello.
Hello.
Yes. Good morning,
Good morning, doctor.
Please,
Sir.
turn down the volume on your radio set, please.
Okay, thank you very much. I've done that.
Yeah, what's your name? Where you calling from?
Okay, my name is Emeka Emmanuel from Kubwa, Abuja.
Right. Talk to us, Emeka.
Okay, thank you. I'm just happy with this program that is coming up because it's really a case we have in hand in our family.
Right.
That we are trying to manage.
Yeah.
My sister, some years ago, got lump, but unfortunately, she didn't inform us, and she got. I wouldn't know that medical expert that she went to after those people that do program, and she went and the lump was removed. After the removal of the lump, that was when she informed us, and unfortunately she completely tried to hide this from us. We kept on trying to tell her to go for continuous treatment, which each time we asked her, she said she's okay.
unfortunately, about a month ago, the whole thing escalated. And we had to now take her to the hospital. Doctor examined her. And at that point, it wasn't up to other 3 days or 4 days. She completely stopped walking. So we got surprised. So, but when the test came out, the doctor said that she had no cancer threat. But the challenge we have now is we don't really know, is there a connection between the lump and the issue of not walking? Maybe because we are suspecting whether it's developing to paralysis. So that's exactly what we are facing right now. And I'm happy with this program, at least that gives us a kind of knowledge from experts. Thank you.
Awesome. Thank you. Okay.
So someone who had breast lump that
Yes.
was removed, that they thought it was cancer. And the report was that it was cancer. But she took time before she went to the hospital, and when they did check, they said there was no cancer again on the breast there. But that is on the breast. If there was cancer and it has moved to another organ, very far, that has to do with balance and walking, maybe the spine or the cochlea or somewhere that has to do with balance and walking. She could have difficulty in walking or keeping balance, while the original point, the whole tumor has been removed by the surgery that was done. So there might have been a connection. It's also possible that she has other what we call comorbidities, other sicknesses, diabetes, hypertension, which could have caused a stroke, or something else would have happened at the same time. Most adults can develop two illnesses at the same time. So until we do more check, we wouldn't know what exactly caused her paralysis.
Okay. Well, you heard it already, my brother. Are you still there, or you are out? Okay.
Yes, I'm still here. And thank you very much. I'm still here. Can you hear me?
Yes. Go ahead.
Yes, I'm still here. That's exactly what we are trying to. It's a very serious case. We are trying to tackle, and we continue to. Good enough. The doctor, after the test, the doctor said there was no. She had no diabetes. There was no spread of cancer, but we're just trying to see what to do to make her also stand on her feet, because she finds difficulty standing on her own, which the doctor talked about the balance. She cannot raise her leg except she uses her hand to raise it. So I think we've gotten the advice. We continue to see how we also seek further medical.
There are some bigger centers that will check the whole body, not just the site. And they will say there are cancer cells here or not. If not, you may now go to another doctor, a neurologist, neurosurgeon, to check why is she not able to raise her hand, is not able to function or stand.
Right.
So you guys are on the right track.
Okay. You're on the right track right there. Well, I've got to let you go now, if that's okay. All right. Yeah. We're taking this other call now. Doctor, it seems as if this is more like an answer to a prayer. Hello?
Hello, good morning, sir.
Yeah. Good morning to you, please. What's your name? Where you calling from?
My name is Mary from Lugo.
All right, Mary. Mary, talk to us. Go ahead.
Yes, please. I've listened to your conversation so far. But I want to say something about the last caller, please. So you people in the studio, please, the doctor, don't be offended. Okay, if the last caller is listening, I want to say that it's not an ordinary thing. Since the cover is not cancer, it's not anything. Please, can you take her to Dunamis if you are around Abuja?
Okay, it's fine.
It's fine.
It's fine.
Every Tuesday.
You passed the message. I get that. Well, I'm sure that before they called in here, they must have done mostly gone spiritual. Yeah, we do understand that there is also the place of spirituality, but we're talking based on science and fact. Yeah. and the spirituality can also do its own part. Yeah, but then I'm sure they must have also looked at all of these possibilities and options. But thank you all the same. I mean, it just means that you're being concerned and you want, this woman to stand up on her feet once again and go about a daily activity. But then let's look at this angle. I mean, quite a number of things going on in this regard, Doctor. Okay. Now, how can we address the social, cultural, and economic factors that contribute to the prevalence of breast and cervical cancers? How can we address this?
Maybe we can finger some of them and try to profile the solutions.
Okay, awesome.
One is ignorance. And ignorance, you will have to sort it by continuous education,
Right.
like I said, like you are doing.
Right.
Like that first lady that you read about
Yes.
who had cancer and is now educating others.
Right.
Like deliberately going to do community sensitization. That may even be in religious houses, in villages, and so on. That will clear ignorance. The other thing is religious maybe inclinations. What that does to some of this problem is that, if God wants to heal the person gets healed.
Okay.
But it may be that what that does, it causes a lot of delay. Now, if you have something that can be solved when it was 5%, and you have taken another route that has spent your 3 months, 6 months, 1 year, and it has gone to 95%. It's going to now be more difficult and more expensive to cure. I think that's what that does. How do we deal with those things? I think again we will need more religious education, that God is ready to solve all our problems.
Yeah.
But God gave us the knowledge to do the ones that we can do. And so people shouldn't be afraid that as long as you are praying, you should also seek help in the hospital. And what the hospitals are demanding is that you should seek help early also. You seek help and seek it early while you pray.
Okay.
So those are some of the cultural things. The other things that we can have in our environment is accessibility.
Okay.
Maybe that's finance-wise or other factors. Now there are national health insurance schemes and different health insurance schemes that people do. That will reduce the burden. But the aim of every health institution is universal health coverage. And when we work hard to achieve that, then we know that we can reduce this lack of access to those facilities. The other one is the one you asked from the beginning. How do we solve the problem? How do we pick it out? And I said that we have primary health centers everywhere.
Yeah.
But do the nurses there or the doctors understand how to examine the breast? And if they do, is it easy for the person to go for the next test? Whether it is a mammogram or a pap smear, is it available for the person to take? Because at those early stages, if you catch the disease, you may aim at getting a cure.
Right.
Those are some of societal problems, and I think those are some of the ways to solve them.
Right. Now, I've heard, that when someone has cancer, you have to go through chemotherapy.
Yeah.
Is this also, connected to that?
Yes, chemotherapy is a treatment modality.
Okay.
Because cancer cells tend to divide very fast, and some medicines will tend to deal with cells that divide, and so they are likely to get more of the cancer cells than the normal body, and then a time is allowed for the normal body to recover.
Okay.
Sometimes you target the particular cancer cells and take the medicine, and they go directly to the cancer cells to kill them. Now, some people will say no, they will not do chemotherapy, they will pray. But I think both can be done.
Okay.
I don't think they are mutually exclusive. By the time a treatment modality is asking that other treatment modalities should not be done, then there is a problem. I'm a doctor. I'm saying that the medical ones should be done, but the prayer also can be done.
Okay,
But
side by
by
side.
the time you say, don't allow injection
Just pray.
to touch your body, it will worsen it. Then there's a problem because you are not explaining it. Or don't allow any tablet to take. There's a problem. You can pray and then you can allow the medical treatment. If God doesn't put his hand in the medical treatment, it's probably not going to work.
Okay, so you're saying the doctors will only try, but God is the final answer.
That's right.
Okay.
That's right.
Well, anyways, let me also ask, this question, and I'm sure quite a number of people have been having this kind of perception. There's a lot of people will say, "Oh, when you have cancer, don't go through chemo. Chemo is the what will even kill you faster. That chemo is not solving any issue. It's only just going to make you suddenly you discover your hair is falling off and all of that. That chemo is not good." What would you say to such folks?
They are acting. If you act on half knowledge,
Right.
it may be dangerous to you sometimes, because if you take chemo, it is true your hair may fall off. It is true it's dealing with all the cells in the body, including
that's
your
it.
normal cells.
Right.
But like I said, there is something that is given to make sure that the normal cells are able to recover, because a rest period is given. That when the chemo attacks the cells, if they are not targeted, some chemo are targeted to only the cancer cells.
Okay.
If they are not targeted, they attack the cells, some rest period is given for the normal cells to recover. And then the abnormal cells does not have the ability to recover like the normal cells.
Okay.
So over time, even though the person will get a little sick,
Oh.
and the hairs will fall and so on, then the person will get better, because most or all the cells will have been killed by the chemo,
Yeah.
and then the person is now better and then recovers out. So I think people need to understand why it is like that. So they say chemo is the one that is killing.
That's killing, yeah. Well, anyways, we still have our doctor right here in the studio. It's none other person but Dr. Talamo Wycliffe Da, is a renowned clinician and expert in obstetrics and gynecology. Right? You want some question right there? You want to put it out there? You already have the number 0907 353 0044. Hello. Good morning.
Is that what?
Yes, Honorable Edwards. Welcome.
Yes, sir. How are you, sir?
Very well. Thank you.
Yeah, I am listening. I have been listening to our guests.
Yes.
That man, how I wish he would be my doctor.
All right. Are you willing
The
to be
man
his
has
doctor?
spoken very well.
He said he's willing to be your doctor. He's willing to be your doctor.
Yeah, I wish that you can link me with the man.
All right then. All right.
My own daughter is a doctor. Unfortunately, she's practicing not in Nigeria.
Oh, okay. Awesome. I get that.
And my own child cannot be my doctor. So I love what this particular man, these are the people that we need.
Right.
And these are the people that you should be inviting them, to keep Eagle FM perfect.
Right.
The man deserves a award. Can you ring a bell for him? I'm
Okay.
just appealing, sir.
All right. That's a bell for him.
Very good, sir. Very good, sir.
All right,
And
Honorable.
equally, try and let me have the man. The man, that's a wonderful person we have in Nigeria.
Okay.
If we can, if I will on my own talk to the authority. These are people that should be given ministerial positions.
Right.
Thank you. God bless you.
Appreciate Honorable Edwards. Appreciate this one from you. Okay. Said, will you be my doctor? He asked. Anyways, we'll take this one here now. Hello. Good morning.
Hello, good morning.
Yes. Good morning to you, please. What's your name? Where you calling from?
Yes. Am I on to Eagle FM?
Exactly. Yes. What's your name? Where are you calling from?
My name is Cecilia from Duvernay.
All right, Cecilia. Talk to us, Cecilia. Go ahead.
Yes, I want to say good morning to the doctor, good morning to the
Good morning,
presenter.
Cecilia.
Good morning.
I said, if it is someone's ovulation, like my ovulation, it pains me down my abdomen, and before you know, I started discharging water. then I will be feeling some kind of pain in my abdomen. If the thing comes, then I'll know that it's my ovulation, and I'll start releasing some water, maybe for 2 or 3 days, 4. So what does that mean?
Okay.
Well,
She's out now. That would not be. I don't think that's in your area.
Okay. Answer
Okay.
Listening.
All right, I get that.
What does that mean? It just means that your body is in perfect shape.
Okay.
Because when you ovulate, ovulation is actually some kind of a violent procedure. There's a bag of egg. There's a bag with water and an egg inside. When it breaks to release the eggs, there can be pain.
Okay.
So you got the pain.
All right.
And the hormonal changes makes the mucus that are from your cervix to be very watery. So you got the watery changes. That means your body is perfect.
Oh, so she's all right.
Yeah, fine.
She doesn't have any.
No.
Okay, no cause for alarm. All right. I wish we can go further with this conversation, though. But yes, it is also very necessary to take some messages from, listeners from across the globe. This one coming from a female says, "I'm so grateful for the awareness campaigns about breast cancer. It saved my life." She's 32. There's this one here now who's a male, says, "As a husband, I felt helpless when my wife was diagnosed with cervical cancer, but with treatment and support, she's now thriving." John is, age 40 right there. This one here from a female: "I was diagnosed with breast cancer at a late stage. If only I had known about the importance of regular screenings." Fatima right there from a regretting, point of view. Well, she's 45 though. And this one here says, from a female too: "As a healthcare worker, I've seen the impact of breast and cervical cancers on women. We need more awareness and access to healthcare." Mary is aged 38. And then finally this one says, "I lost my mother to cervical cancer. It's a devastating disease that needs more attention and funding." All right, David is 50 now, and he's already making that conversation. Sorry for your loss, David. Okay, so we could have gone through some of these other questions, though. But you've trashed most of it, so it's almost more like a reputation. But there's also been some underlying factors and strong insinuations have been linked to this, conversation. One of such would be poverty, right? Poverty being a very significant underlying factor in the prevalence of breast cancer and cervical cancers in Nigeria. And if we are able to address the issue of poverty as well as access to healthcare, we should be able to have, good. Yeah. And then we look at the lack of education. Now, one of the things you mentioned was, there's no ignorance. That's it. And of course, the channels that should indeed put out these information are seemingly slim. And that's why we need to explore more. And that's why we have this mass media here.
Right.
And we're talking about that. And then, of course, cultural and social norms can also be, traditional, cultural, and, some inhibitions and all of that. Well, thank you so much, though, for stepping into the studio to have this vital conversation with us this morning, Doctor. You are Dr. Talimore Wycliffe Dar. I like that da part. Okay. You're a clinician and expert in obstetrics and gynecology. Thank you for your time.
Thank you. My pleasure.
Appreciate. All right. So this is where we call it a close. Thank you, too, for keeping ears. Remember to follow across social media platforms, Facebook and YouTube at Eagles FM Abuja as we streamed live, and catch the conversation in case you missed it so you don't miss any vital part of it. Okay?